Continuing our discussions on coping with COVID-19, we take a look at the life beyond lockdown. And here to discuss what we know about vaccines is epidemiologist and member of the Regional Incident Management Support Team at PAHO, Dr. Eldonna Boisson, who's joining us via Zoom. Good morning, Doctor.
Good morning, Lisa.
Okay, so we're talking about vaccines. Walk us through the process of developing vaccines.
Okay. I missed the first part of your question, but I believe you asked me to walk you through the process of developing vaccines.
That's correct? Yes, that's correct.
Okay, sure. So the process of developing a vaccine is usually quite long. It usually would take about 5 to 6 years.
Yes.
Because when they develop a vaccine, the first thing they have to do is to get the genetic sequence of the virus so that they get a vaccine that can actually target the virus.
Yes.
After they've done that, they then have to do clinical trials done in different phases, normally 4 phases of clinical trials. Sometimes they combine phase 2 and 3 to make sure that the vaccine is 1, safe, and 2, that it actually works, that it's effective. We have a lot of people dedicated to looking for a vaccine right now around the world. And so we anticipate that it's possible to condense that time to about 18 months to 2 years.
Yes.
Because so many people are working on it.
Are these persons working together? Let me just jump in there. So yes, we've heard of persons in Germany and, China, the US, the UK. I even understand that some of our own experts here have been weighing in. Is it that it's a collaborative team or it's a race to see who gets a vaccine first?
There is some collaboration, but it's also a race. They have people independently working as well. So some collaborate, but some are working independently. And even when they find a vaccine, they then have to mass produce, because obviously nobody in the world has been vaccinated yet. Yeah. So we're looking to get vaccines for a really large number of people. So best case scenario, we're looking at about a 12 to 18 month period.
Yes.
So not before probably middle of next year at best.
So what does that mean for us in terms of the lockdown and going back out without a vaccine?
Well, the vaccine is here and we're here, and we have to find a way to live with it. We obviously cannot remain in lockdown because our economies cannot handle that.
Right.
And so we're going to have to find a way to phase ourselves out of the lockdown in a very careful and phased manner. And it may be also not just on one trajectory. We may find that we relax and we have to stop and wait. And depending on what we see, we may have to reinstate, relax. So we may go through a process of up and down relaxation and reinstating measures, but it's going to be in a phased manner. Relax, watch and see what happens. Depending what we see, WHO would recommend that you can relax some more, or you may have to reinstate.
Yeah. Doctor, we have about just over 3 million cases worldwide, but 1/3 of that, just over 1 million, would have recovered, and just over 200,000 deaths. So it seems as though recovery is, well, from the beginning of the virus, recovery has been outweighing, the number of persons who died. Does it mean, therefore, that not everyone would have to be vaccinated, as we are seeing touted by some persons who are saying that, even children from newborn should be vaccinated once we get a vaccine?
Right. Well, vaccination is not a mandatory thing. We have a flu vaccine, and not everybody opts to get the vaccination. It's a personal choice. And every year we have about 1/2 to 3/4 million people dying of flu globally every single year. And still not everyone takes the vaccine. The fact is, though, that nobody would have had this vaccine before. So even if we consider that some people will not take it, there will still be a lot of people who would choose to take it. We would recommend, of course, those who are most likely to be at risk of having severe disease should be the ones who take it first, which would be, of course, as you know, the elderly and those with underlying conditions.
And what would the rollout look like once a vaccine comes up? What would the process be like?
Can you repeat that? I didn't get the first
What would
bit.
it look like once we get a vaccine? What would the rollout look like? The implementation of a worldwide vaccination plan?
Right. So the last stage in developing the vaccine, as I mentioned earlier, is actually to mass produce, because when you get it, you now have to produce a lot of it. And so we're not going to get all in one shot enough vaccine for everybody who needs to be vaccinated. And so every country, we have recommended that you do your prioritization list in terms of who will need to be vaccinated first as the first batches of vaccine become available.
Yeah.
And so the priorities would be the elderly, those with underlying conditions, and certainly healthcare workers, because those are the persons who have to take care of sick persons. And so we have already got countries thinking about and trying to start to make their calculations in terms of how many vaccines they will need to cover who they consider to be their most vulnerable population.
Yeah. There are concerns about, because persons who are anti-vaccination talk about the side effects. Would 12 to 18 months be sufficient time to know what these side effects would be and to do the relevant testing?
Right. That's a very good question. And that's precisely why developing a vaccine takes so long, because you need to make sure not only that it works, but that it's safe and there are not side effects. And so even though the developers can condense the process, they still absolutely have to go through all of those steps. And even when you have a vaccine on the market, all the vaccines that we have available to us that we're quite familiar with, we always have surveillance for adverse effects taking place, because you never know what can happen. So that never stops.
Doctor, before I let you go, one last question. Everyone's excited for borders to be reopened, but how would protocols change? I'm seeing the Schengen states saying that you would have to have a COVID test, perhaps maybe a mandatory vaccine like yellow fever in some of the territories right now. Do you foresee this?
Well, that's really hard to say, and every country is going to be making their decision. Even as you made reference to the yellow fever vaccine, some countries are required to have it, and some countries, when you enter, they demand to see your certificate, and in others they don't. So it's really going to be a country decision.
Yes.
We have a lot of vaccines already available, and we therefore have things that we can look at. There's discussions about immunity passports. That's not new, as you said, with respect to yellow fever.
Yeah.
But it's hard to know at this point in time what would be the best suggestion. Until we actually have that vaccine, until it's rolling out, until we have more tests that are effective, like a rapid test that is effective. We don't have that right now. It's very hard to say what countries will decide, because we don't know the full set of tools that they actually have in their toolbox, or will have in their toolbox at this point in time.
Good morning, Dr. Boisson. I just have a question in regards to the vaccine. Now, as we know, COVID-19 is within the family of coronaviruses, just like the common cold. And as we know, there is no cure or vaccine for the common cold at this point. How will they successfully develop a vaccine for COVID-19, which does have similar characteristics to the common cold?
Well, there's no guarantee. We're saying best case scenario, 12 to 18 months. But there's worst case scenarios. I mean, we've had dengue with us for a long time, and we have been trying to find a vaccine for dengue, which to date we don't have. We came very close at one point, but then it was found not to be safe. So best case scenario is 12 to 18 months, but that's certainly no guarantee, unfortunately.
And if they do happen to develop a vaccine for COVID-19, would it then allude to the point that it may be possible to create one for the common cold as well, being that it's a coronavirus as well?
I mean, anything is possible, but some things are, as I said, difficult. Until it's actually done, it's hard to say. There are other diseases that we're trying to create vaccines for. The developers have been trying to create vaccines for many years with no luck. And then there are some that they have been able to create vaccines for. So, I mean, we really have to watch this space. There's a lot of work going on around the world, but until the vaccine is actually made, untested, there's really no guarantee.
Yeah, that's right.
Well, Dr. Boisson, that's where we're going to have to leave it. But thank you so much for clearing up some of the questions that I know not just we had, but many persons out there. I'm sure we're going to be tapping into your knowledgeable base very soon. And good morning to your colleague, Dr. Wheeler, as well. That was Dr. Eldonna Boisson, epidemiologist with PAHO, joining us here for Coping with COVID here on the Now Morning Show. We're taking a few messages. Come right back after this.